Hi everyone, it's Dr. Baker Towns. I want to welcome you to Women's Health. We're going to talk about OB and Women's Health, so it's an exciting class, lots to learn. But we're going to start by doing a review of your anatomy and physiology actually. So if you want to follow along in your book, which I encourage you to, it's on Chapter 4, pages 59 through 62. So our learning objectives, of course, we're going to just identify the structures and function of the female reproductive system. We're going to first look at the external genitalia. The mons is here. The clitoris is your sexual organ here. The urinary urethra is right underneath that. Please make sure that you review urinary catheterization for women, as you will do these during your rotations at the hospital. So please make sure that you have reviewed that. Skene's ducts, there's Skene's ducts here. These are mucus secreting glands, Skene's glands. And then there's a duct here. This whole thing is called the introitus, which is just the overview. The majora are the outer portion, and then the minora are the inner portion of the introitus. This portion is called the perineum, and then you have your anus here. Also, there are Bartholin's glands that are deep in this tissue, and then here are the openings for the Bartholin's glands. So I want to look at a video real quick because this video is a 3D version, so I want to show you these structures in the 3D version real quick. Okay, so here it is. So this is a lateral view, and you can see here's the bladder, and it's going to go through the organs. Here are the ureters. You can see as the uterus grows, these could get compressed. Inside your bladder, your ligaments that hold it up. From a superior view, you can see the external layer. The middle layer is the muscle. And then the inner layer is the mucosa, and this layer is the one that gets infected when you have cystitis. Cystitis is infection of the bladder. Many times during intercourse, bacteria is pushed into this urethra, goes into this bladder, begins to proliferate. So therefore, it's really important to educate women that they should void every time that they have vaginal intercourse. We can just see the sections of the bladder. You can see where the ureters dump into the bladder. Lateral view, the bladder neck. Sometimes after, sorry, that's my dog. Sometimes after pregnancy, this is stressed. Estrogen goes down, and then the bladder neck becomes loose. It can get compression. So when they talk about a bladder neck or a bladder sling, what they're attempting to do is take some mesh and pull it up and put a sling on this bladder so that they can restore function, and this is no longer compressed. Here is the vagina. Here's the vagina, the rugonated vagina. You can see that's under the influence of estrogen. Here's the uterus. Here is the cervix, and this is what we see when we're doing a speculum exam. We can see the cervix. That's the bottom portion of the vagina. You can see there's an external and an internal os. This is the portion that will dilate when you go into labor. The uterine isthmus is right here, and then the top of the uterus is the fundus. This is the fundus. The cul-de-sac are these areas right alongside of the cervix. The myometrium is the muscle, and then the endometrium, very important. These are the cells that proliferate, and these are the cells that will come off of the lining of the uterus. They will come off. The endometrium will shed, and each month with menses. From the superior view, you can see here is a fallopian tube and the ligament that holds it up. Here's the tube. You can see it's nice and patent. These are not important structurally for you. And then the isthmus, the ampulla. This is where pregnancy occurs. This is where actually fertilization will occur in the tube. So the sperm will come into the tube. The egg will come out of the ovary into the tube. There'll be fertilization. And then it will come along down with the aid of peristalsis and dump into the uterus to house the embryo very early. See, this is the fimbriae. There are the ovaries. The rectum is right here in the back. What I want you to notice is this pelvis is very small, and it's housing this bladder, which can get distended, is housing this uterus, which can get very, very large during pregnancy, and it's housing this rectum. Obviously, the ureters are down here as well. So when the uterus grows, obviously it can put compression on all of these structures. Many women complain of bladder sensitivity and not being able to, and they have to void quite frequently, is because this gigantic uterus, it's not gigantic now obviously, but as it grows it presses on their bladder, so they're not able to hold a residual amount. I mean, it's very small how much the bladder can hold when there's no room. And then the rectum, of course, can be compressed. Some people even get constipation secondary to just compression. And then the ureters can get compressed as well. We can see people, sometimes we'll get a compressed ureter and we have to go in there and put a stent to open it up so urine can flow down from the kidney, down the ureter to the bladder. Here's a superior view, and again, here's just the bladder, the ureters, the uterus, fallopian tubes, the ovaries, the uterine bodies here, and that's what's going to get larger. The baby is housed in here, the embryo. And then the rectum. This is also the pelvic floor. These are all the muscles that hold everything together. Okay, so we're going to go back to our PowerPoint. Sorry about that. All right, so we're going to look at the structures from a lateral view again. You can see how small this is, and then we can see this cross section of the same organs, and you can see their exact positions. I do want to point out one thing that we did not look at in the previous animation was this round ligament. You can see the only place where your uterus is solidly anchored is at your cervix and your vagina. You can see that right here. These ligaments will stretch as the uterus grows. It's going to grow way up here. And so these round ligaments will stretch, and these can cause people some pain during pregnancy. But you can see as this would grow how these would stretch. Kind of already looked at this. So I kind of want to talk to you now about the actual pelvis. This is the pelvis. As you can see, these bones are all separate. You can see the right side, the left side, the sacrum. Here we go. And this shows it as one unit. It's because the ligaments, these are the ligaments, are all holding it together. So this top part is the false pelvis, and this bottom part is the true pelvis. The baby actually has to fit through here. Okay, this is the part that we worry about. And your cervix is actually right here. In these, there's some ischial spines, and it has to fit through there. So this part is super important to us. And actually, this false pelvis just kind of protects all of our organs. Anterior to posterior aspect. So you can see that this is the coccyx, and so you can. I'm sorry, this is the pubis. And so when we do a vaginal exam to see how big your pelvis is, we're actually putting our thumb here and we're measuring with our fingers from anterior to posterior to make sure there's enough room here for a baby to come out. Lastly, I wanted to show you these separate bones are all held together by these ligaments. Very important to know because these ligaments will go under a dramatic change during pregnancy. I want to show you about the pelvic floor. So when you look at a superior view and you're looking down, you can see that this is all the muscles that hold everything together. These muscles are so very important. This is a lateral view, and you can see this is them. You can see here's your bladder, here's your uterus, here's your rectum. And so you guys, so important for people to do their Kegel exercises and to strengthen this pelvic floor, because as pregnancy continues, this uterus will begin to contain heavier and heavier and heavier volume. Well, the amount of weight inside of the uterus will continue to grow, and that's going to put pressure on this pelvic floor. If people do not do their Kegel exercises, this pelvic floor will have atrophy, and it will never be the same as it was prior to having a baby. This will be loose and flaccid. So super important to do Kegel exercises, even before pregnancy, during pregnancy, after pregnancy. What's interesting is that when you do them during pregnancy, it's like you're actually weightlifting. So you can see here the pelvic floor muscles as this grows and gets larger and larger and larger and heavier and heavier and heavier. Every single time you do a Kegel exercise, it strengthens this even more every single day. So this is a big reason why women have incontinence issues after delivery, is because this weak pelvic floor. And that is something that we're going to try to convey to women, is to do pelvic floor training and exercises prior to, during pregnancy, and after pregnancy. Okay, so this is the uterus, and this is just an illustration of the muscles in the uterus. So the ovarian ligament is here. Here's that round ligament that stretches. Remember I told you guys that this thing's going to stretch. This uterus is going to grow really big. And these ligaments are going to stretch with it. As it goes up, these ligaments are going to go up and stretch out. And a lot of times it causes people pain. I do want to show you this. I'm going to attempt to draw. We'll see how well I do. So I want to show you when people have a C-section, they used to cut the C-section like this, a straight up and down line. Oops, that doesn't look really great, but this is the best I can do for now. So they used to cut this straight up and down line. And you can see where that disrupts these uterine fibers. You can see how these are going in a circular type pattern up here, circular pattern up here. They're going horizontal down here. So what you're doing in essence is the surgeon is disrupting all of these fibers. When people have a uterine contraction, the contraction starts up here and goes down and then pulls against all of these. So someone who has a uterine incision like this cannot have a vaginal delivery after a cesarean, because during the contraction phase, this could tear open. We always know that anytime there's an incision, it's an area of weakness, and so this whole uterus, could come open during the actual labor phase. Now, a low transverse incision would be one like this, and you can see that only a few muscles are cut, and all of these are intact, which is amazing. So you can have a vaginal delivery after a cesarean section, because when you contract, there's no weakness in the uterine muscle. Just want to show you that little bit. Okay, what you're going to do next is take your quiz, and that's all we have for now. Thank you for the review. Bye-bye.